I'm David Trickey. I'm a consultant clinical psychologist. I work here in the Specialist Trauma and Maltreatment Service at the Anna Freud National Centre for Children and Families, and I specialise in working with children, young people and their families who have experienced trauma or traumatic bereavement. A service ought to diagnose someone by collecting lots of different information about the person's problems and difficulties. They should take information from the interview with a young person, perhaps with their carer, perhaps a report from school, perhaps the answers to their questionnaires that they might use, and then they weave all of that information together and they compare that young person's difficulties to the profile of the diagnostic classification system. And the clinician's job is to work out, does that young person's problems match up to the classification for that particular diagnosis? So the diagnosis should really be a very accurate description of the person's difficulties and problems. And that means that other health professionals will know what's going on and will have some ideas about the difficulties that they've got. But more importantly, it means that we can provide the appropriate intervention. So it's a bit like identifying the right bug that someone has so you can give them the right antibiotics. Because, for example, post-traumatic stress disorder needs a different type of intervention to depression. And some of the difficulties overlap, so there may be some confusion. So it's really important that we have an accurate diagnosis so that we know how best to help the young person. Yes, it does, and that's really helpful because it will help different healthcare professionals to know the sorts of difficulties that you've got. So that's important both for providing the right intervention for those difficulties, but also it might be really important for other healthcare professionals to know about those problems, both at the moment but also in the future. It might be really helpful to know that in the past you've had particular problems. And if you're worried about that at all, you can always ask to look at your medical records, and if you think that they're wrong, you can actually challenge them. No, absolutely not. A diagnosis is just an accurate description of the difficulties you're having at that particular moment. About 1 in 10 children and young people would have problems that would fulfill criteria for a diagnostic category. And the whole point of that diagnosis is to help the healthcare professionals provide the best help possible to either decrease those problems or to help you manage them. Well, the label isn't a label for you, it's a label for some of the problems that you're having. And the reason we have the diagnoses at all is to help the healthcare professionals provide you with the best possible care and help. And if you're worried that you're being labelled rather than your problems, then talk that through with the person who's making the diagnosis. Discuss your concerns with them and see what they have to say. It's really important that you discuss that with the clinician that has made the diagnosis, because ultimately the diagnosis is there to help provide the best help and intervention for you. And if they've got that wrong, if they've made a mistake, or if they haven't taken into account all the information, they need to know that. So I would discuss it with them, ask them to show you how they came to that particular diagnosis, and discuss with them which bits you may disagree with. And hopefully, between the two of you, you can come up with a shared understanding and a shared agreement about what the diagnosis is. Ultimately, if you think you're not being listened to and you need to take things further, you might want to look into what complaints procedures the service has.